It's been just over a year since the first.
Boosting Immunity, Hawaii's Best Shot, is sponsored by Doctors of Waikiki, Hawaii's best urgent care.
Is it necessary, and how will the boosters help us all move forward as the pandemic continues? That's what our panel tonight is here to discuss. Lieutenant Governor Josh Green, the state's COVID-19 healthcare liaison, Dr. F. DeWolf Miller, University of Hawaii John A. Burns School of Medicine epidemiologist, and Dr. Alan Wu from Doctors of Waikiki. Thank you all for being with us. And before we start with the questions, we want to begin by going over the latest data. 74.9% of the state is fully vaccinated, having received the first 2 doses of Pfizer or Moderna or the single-dose Johnson & Johnson vaccine. People 12 and older became eligible for a booster 5 months after those primary vaccine series. And of those eligible for the booster, 56.1% have received the booster or their 3rd shot. These are the latest stats from the Department of Health. So first we'll start with Dr. Green. What does the data show about the benefits of the booster when it comes to preventing hospitalization or serious illness? Lieutenant Governor.
It shows that if you're fully vaccinated and then boosted, you have about a 90% decreased risk of getting severely ill. And what we also saw in a lot of different parts of the world is, for example, in LA, people who had been fully boosted had a 23 times less likelihood of going into the hospital. So what I'm seeing as a doctor is people may still catch the virus, even if they've had vaccinations and boosters, but they don't end up in the intensive care unit and then end up critically ill or on a ventilator. So that's the best protection, getting that booster. Right now, over 500,000 of our people have gotten the booster, and it's a really great amount of progress, but there's still 391,000 people that are eligible as of today to go and get a booster and prevent severe illness.
All right. Dr. Miller, can you answer that same question, what you're seeing in the epidemiological data for how these boosters are preventing hospitalization and serious illness?
It's the same. It's just, I think Dr. Green was very eloquent and thorough in his answer. The boosters boost immunity to another higher level, which give you better protection. The thing that's concerned me is the people who haven't gotten their booster yet and how we get them boosted. That's what I want to focus on, at least, because the evidence of efficacy for boosting, as Dr. Green so well put out, is all there, both here and nationally and internationally. It's unequivocal. I just call it a 3rd shot. And I think I was talking to Dr. Wu earlier that what's in the booster is the same thing was in the 1st shot and the 2nd shot. It's the same vaccines, same material exactly. They're not getting something new and different. Although I think later on you'll ask us about mixing and matching. But the point is how do we get people, how do we get that remaining group that you pointed out there boosted?
Right, yeah, and how do we get them to be motivated? Dr. Wu, as people come in, are they asking questions about the booster that they didn't have about the first 2 shots?
I think as we get into this pandemic a little bit more, a lot more people have a lot more questions about, why am I getting this other booster? Why are we doing all of this? So it's really important. We really want people to get this 3rd shot because it does boost your immunity, like Dr. Green and Dr. Miller says. You are going to feel tired. You're going to have some side effect. Remember, it's waking your immune system back up again. And to get to that high peak value with the interferons and the cytokines, these are all medical terminology that is part of our immune system that really help us to develop our immunity against this virus. So there's a lot of questions, and we have a lot of great discussion with our patient.
I bet. And we'll stick with you, Dr. Wu, with this Omicron variant. What are you seeing in the clinic from folks who come in sick? What's the differences that you are seeing in their illness depending on vaccination status?
What we are really seeing between people who don't have any vaccines, we are seeing a higher rate of hospital transfer offer from urgent care centers like ourselves that if you're not vaccinated, when you contract COVID, you are going to have a lot more symptoms. And those patients tend to get transferred to the hospital because they need a higher level of care. When we see people who are fully vaccinated getting two of the vaccinations, they're symptomatic. Some needs some medication to help them fight against the symptoms and make them feel a little bit better. And when we see people who are having breakthrough with the third booster, they tend to be a lot better. They have a little sniffle, they have a little runny nose, they have a little sore throat. Some might have fever, but most don't. And it's more of a common flu or common cold-like symptoms for people with the booster who have a breakthrough infection. And they tend to do really well. They recover really well too. They come back in 5 days. We reevaluate them before we let them go back to work. And those patients tend to do well compared to unvaccinated and also fully vaccinated patients. And these are what we see as healthcare workers in the front line. And we really encourage this third booster.
Sure, and we hear that, anecdotally from friends or colleagues who unfortunately get it. They say, God, it just felt like a bad cold if they were boosted. Now, what are you hearing from patients who did not get the booster yet about the reasons why they haven't? Dr. Wu?
Well, I think a lot of miscommunication is getting passed around. A lot of people, well, I already got the first two, I didn't get it. Why do I need the third one? Well, as you know, that we had a Delta surge and now we have Omicron surge. And there will be more surges later on. Might not be as big as Omicron. We can't predict that. But I think knowing that you really need to just wake up your immunity again to fight against these, it's really important. And of course, as we move along our pandemic, we'll have better treatment, better vaccines, and newer targeted vaccine will be coming out soon in the next future. So I really encourage people to continue to educate themselves. Read resources from accredited sources. Don't read things that are from social media platforms. I really encourage people to look at journal data and to see and get those information there and to educate themselves to get the booster. And there's a number of reasons why to get it, but really it comes down to protecting our loved ones. I have a 3-year-old who is not qualified for vaccination yet, and I really encourage our entire family to make sure that we're boosted so that we can protect her, my 3-year-old. And we do have chemo patients at my household, and we really also encourage everybody to just get safe and get boosted. So those people are at risk, and we really encourage that.
Thank you. And Dr. Green, as you talk to folks, whether they're constituents or patients of yours as a doctor, what are those who haven't been boosted yet telling you are their reasons why?
A lot of people tell me that they're just tired, they're fatigued by the COVID pandemic. And I think it's reasonable for them to be saying that because it's been very tough on all of us. And like Dr. Wu said, they did get the first 2 shots and they felt, okay, things have been good for them. But I explained that their immunity drops off very significantly after 5 months. And almost always people who I do see that are severely ill either haven't been vaccinated at all or they've got some underlying health condition and haven't had a booster. And then they're sick as can be. Often they're the ones that go to the intensive care unit. So we weigh those things, and most people then tend to get a booster after hearing that. It's been pretty good. We're over 56% for people who are eligible to get the booster, and that took a commitment to get that third shot. I'm also hearing a lot of our elderly patients are eager to get the booster. They're actually eager now to get the authorization to get a 4th shot. A lot of people call me up and ask for that. So it's very different between young and old. The younger individuals tend to say, I think I'm okay. Older people prefer to get the booster. So I just try to encourage them. But remember, if you've been 5 months or more since you've had your shots, your immunity has dropped off. And that's why people are in the hospital I think 48% of all of our cases in the hospital right now are people who have been vaccinated with 2 shots and didn't go forward with the booster yet. They're not super sick, they're not in the ICU, but because 1.1 million of our people have had 2 shots, it becomes kind of a higher probability that they will be in there. It's really just a process, and we have to keep encouraging people because they'll stay more well.
Thank you. Well, what about the data on mixing and matching vaccines? If you get a Moderna booster after an initial Pfizer series or vice versa, does this help your immunity? Dr. Miller.
Yes. It doesn't really matter if you decide, if you go back to get your booster, which I hope you've done or are going to do or plan, and you get there, they say, well, we have a Pfizer vaccine for you. Don't hesitate to take it. Oh, I wanted Moderna. Oh, I got to the Moderna and I want a Pfizer. Don't get caught up in this silliness of they're both good boosters. I hear this, that, oh, I want this one or that one, and you've gone to the trouble to go and get the booster, which is great. And then all of a sudden you're backing off and say, well, I'll come back for the other. Don't. Just get it right then and there. Don't do any more hesitation or procrastination. Any excuse not to get it ought to be put aside. Okay, we really want people to go and keep our kapunas safe, our kids safe, and our whole hospital healthcare system from being crushed by these ongoing surges of this virus. And so it's just essential that they go and get it. It doesn't matter. Just get whatever they've got, get it.
I really encourage people just to get the 3rd shot. There's some data that shows that there is some improved immunity if you mix and match, but not necessarily true for every individual. It's individualized, and I really believe that. Just having the 3rd shot is great. And that's why we encourage, if you have Pfizer, you want to always go with Pfizer, you can do it. If you have Moderna and you want the 3rd shot to be Pfizer, do it. Or vice versa. There's no real hard evidence right now that mixing and matching tend to be better or worse. I don't think we gathered enough data to kind of make that general assumption. But I do really encourage, if you don't have any allergies to the mRNA-based vaccinations, continue with those.
And Dr. Wu, can you also add, if you had the Johnson & Johnson originally, what are you supposed to do?
For the Johnson & Johnson, is a vector-based vaccination. So we really encourage that if you already had that, get your booster with the mRNA base, whether it's Pfizer or Moderna. Those tend to be a lot more effective, and they maintain your immunity a little bit longer than the vector base. So right now you will see the recommendation after Johnson & Johnson, you're supposed to get a booster after 2 months. But if you really look at it, after 5 to 6 months getting a mRNA-based vaccine, I think it's better to just kind of switch.
Okay. Now, boosters are slowly becoming a requirement for more activities, like on Maui, where it's now required to be considered fully vaccinated and to go to a gym or dine indoors. Also, safe travel's expected soon. Will more changes be coming to state and county rules? Dr. Green.
That's being debated right now as we speak. The governor's traveling, and we've been briefing him as he goes about what people are feeling on the ground. It looks to me like we had initially felt that there had to be, I guess, a statement about being up to date, meaning that you had to get that 3rd shot if you're due for it. But we also are seeing a steep decline now in the cases of Omicron. Omicron is down now like over 30% just since its peak on the 21st. So in the last 10 days, the case counts have dropped 10% and the hospitalizations have dropped close to 20%. So you're seeing that steep decrease. And it appears to me that we will probably have the Department of Health offer guidance rather than making major changes to safe travels or any of the rules. Now, the mayors will each have the prerogative as they need to protect their communities. For example, Maui and Mayor Victorino kind of pushed all in and asked that people get that booster in order to meet the criteria to go to restaurants and what have you. And his reasoning was this: Maui's hospital was really seeing a large surge. Maui had a larger surge for its hospital population than any other region. And they also were trailing by about 2 weeks. So he was really wrestling with resources. Whereas we're starting to see the hospital numbers really drop quite quickly. We're down, 30 patients in the hospital. It was 347 yesterday that were acutely sick with the Omicron variant in the hospital. Today it dropped to 317, and that's big in just one day. So I think by mid-February, when those changes were due, you're going to see much lower numbers, both as far as cases and in the hospital. And I'm guessing that we will begin to pull out of kind of the restriction phase of COVID and go more just towards the Department of Health guidance phase, which is what things were always like before. We want to get back to normal, or some people say new normal, but we want to kind of restore some hope that it's going to be a good 2022 without all these rules.
Yeah, that's for sure. Well, this is also a good time to talk about some of those terms that we heard the Lieutenant Governor use. Now, the Department of Health says fully vaccinated refers to people 2 weeks after they get their primary dose of vaccines. For Pfizer or Moderna, that's 2 weeks after a second shot. And for Johnson & Johnson, 2 weeks after the single shot. There's also the term up to date, which means if you are eligible for a booster but haven't gotten it, you are not up to date. And the CDC says you're boosted and up to date right after getting that booster dose. All right, well, can you explain a little bit about the pivoting of language that's happened recently with the CDC, with less focus on vaccinated and more on this term up to date? Dr. Green.
Yes. So we know now that if you are waiting on your booster, if it's been a long time and you are not up to date, that you're really putting yourself in a predicament, because you're much more likely to get a severe case of COVID, whether it's the Omicron variant, which is by far the prevalent variant of our time, or Delta, which is still circulating. You're not really well protected. In fact, you're only getting protection in the range of 37% to 55%, somewhere in there if you've had your 2 doses and it's been a while, as opposed to this 90% protection. And I think that's why they're pivoting towards kind of explaining that you are really fully vaccinated when you've had that booster, when you have the opportunity. Of course, some of our children are not yet there because they started later or it hasn't been authorized yet. We're only now discussing vaccinations for the very young. But I think the CDC is very smart to be looking at it this way. And over time, this will be much more like the flu, where you'll get an annual booster or something of the kind. Some of these shots are now going to be updated too. So I think that we will have a variant-specific vaccination going forward for the booster. In other words, one that is Omicron-oriented. It's got a little bit of a different shape, and that's what will be in the vaccination.
All right. Well, it's time for a quick break, and we'll be right back with more questions for the panel in just a moment.
Doctors of Waikiki is your source for the very best urgent care in Hawaii. Innovative technology, superlative expertise, practiced with our thoughtful and comforting manner. We're your source for COVID-19 testing and diagnosis. Visit our website today to schedule an appointment. Open 7 days a week with an in-house x-ray, pharmacy dispensary, and extensive laboratory, plus free Waikiki transportation and a multilingual staff. Doctors of Waikiki, compassionate care, advanced medicine, close to home.
Well, welcome back. Let's get right back to the questions. For those who got the booster, so they got that 3rd shot, what do you see happening as far as the need for a 4th dose? Are some people getting those already? Dr. Wu.
Well, we do see a lot of people who gotten their 4th dose already, especially some of my patients who are eligible for it after 5 months due to the fact that it's their age and they have underlying medical conditions that makes them immunocompromised. So we have seen a bunch of patients who had their 4th shot, and they have the same side effects that they have that other people have with their vaccinations, but tend to be a lot less. I have been told that a lot of them report a lot less side effects from the 4th shot, and we will be seeing, like Dr. Green said, a newer version of these vaccines, probably in the next 1 to 2 years, that are more specific to the different type of variants that we see.
Well, some people may think that since we're being asked to get a booster less than a year after our initial 2-dose series, that somehow the vaccine doesn't work. What do you say to that, Dr. Miller?
I was surprised to see the question. I didn't know that there were people that actually thought the vaccine didn't work because we have to get a booster. So we were just talking about this with Dr. Wu, with Alan, about where did this come from? What kind of idea would support the idea that the vaccine doesn't work when we clearly know that even the first 2 shots work? And I have a paper here, okay, from the Journal of the American, let's see, it's JAMA, it's the Journal of American Medical Association. I'm a co-author on it, okay, of national data. It shows that more vaccine, less infection. Okay, and so we know that these things work. If they want to ask me, yeah, they're working. Booster makes it work better. That's all.
Well, we've talked earlier in the show about how future doses will be adjusted to account for changes in the variant, like with Omicron. So with that in mind, should people be waiting to get their booster, in case there is a booster specific or a change in the vaccine? Dr. Green?
The answer would be no. You shouldn't wait. If you're due, please go get the booster, because what we've seen is really 2 different pandemics. The Delta pandemic had very severe illness. We didn't have a lot of immunity yet, and we saw about 4 out of every 100 people that caught it end up in the hospital very sick. Because we've been up to date on our boosters and the shots, we now are seeing far fewer people end up in the hospital. Though Omicron was super contagious, we described it as having an R0 of 10, meaning one person would infect 10 others. We know that they didn't end up in the hospital very often, and that's because people got vaccinated and because people got boosted. So when your time comes, get that shot. And then when the recommendation comes, whether it's 6 months or a year after that, also follow that guidance if you can. We should respect people who have differences of opinion, but it is very important that we keep society healthy and safe. And that's what these shots have actually done. Hawaii's done it better than almost anyone, and it's why we have the 2nd lowest rate of COVID and the 2nd lowest death rate for COVID in the whole country.
Right. Now, during the Omicron surge, a lot of Hawaii residents caught COVID. How soon can they get a booster? And what is their immunity level like in the meantime? How long does that natural boost add on top of a prior vaccination if you're not boosted? Dr. Green?
Well, a lot of physicians have differences of opinion. You should be asymptomatic after your illness. A lot of people say wait a month, and then after a month, go and get your booster. You do get natural immunity to a good degree, but the shots have been really multipliers of your immunity. They work slightly differently, and people are getting a lot more immunity from their vaccines than they are from kind of modest or not severe illness. So I think it's very important to go and get that booster a month later. And that's the best guidance we can give. It is an inexact science because this is the first time we've gone through a COVID pandemic or a coronavirus pandemic in a very long time of this magnitude. But always talk to your doctor or your nurse practitioner or PA, and they'll give you the right advice.
Thank you. Now, what is your final message to those who think they don't need a booster or are still hesitant to get that next shot? Dr. Miller?
We all sit around and try to think of ideas about how to encourage people, make it easier. We've often talked about strategic immunization like they did with polio and smallpox, where you actually go to the people and bring the immunization to them. With this cold chain that we have, it's not going to be that easy, but it would be nice if we had a vaccine in the future that you could just get anywhere, even if you could take it to them, like a recombinant subunit protein vaccine that we're making here in our laboratories at the University of Hawaii. Okay, I had to put that plug in, all right? Thank you for putting up with me, colleagues, for this. But it's important. We have a really fantastic faculty member here, Dr. Axel Lehr, and we have a vaccine that you could give worldwide that doesn't have this difficulty of what we call a cold chain. I mean, dry ice is something that is not easy to move around. But having said that, I want to refer to them on what we can do to promote this issue of getting your booster.
I really encourage everybody to get their 3rd booster, or even if you're qualified for your 4th, go ahead and get it. I think Dr. Miller and I were talking about this earlier. You get your full 2 doses if you did the Pfizer and Moderna for yourself to protect yourself with your immunity. but you get your third one to really protect others too. So, the first two for yourself and the third one for the rest of your family and your community. And we are one Ohana, whether you like it or not. We live on this island. We're all part of one gigantic Ohana. And our goal here is to protect everybody. And I also would like to lobby for a lot more private physicians and private urgent cares like ourselves to have access to give vaccination to our patients instead of just a hospital and the pharmacy, because we have a captive audience here. If I had the vaccine in my hand, after talking to them, we can probably convince them to get their third one if we all had it in our offices, whether you go to your PCP, your nurse practitioner, and PA. If we make it widely available, it will be even better.
My message is just because we care so deeply about people to keep them well and keep them alive, the booster is the right thing to do. You are very, very unlikely to get severely ill if you've had your 2 shots and a booster. We're just not seeing those individuals who are fully boosted ending up in the intensive care unit or on a ventilator. So to save lives, especially for our kupuna who we love, that is the best thing to do. So it's all about public health. People do have to do their own research and soul search on this kind of a thing, but it does save lives, and the booster is extraordinarily protective. So we've seen that is necessary to protect the health of all. So do it for our people in Hawaii, and do it for your family and yourself. That's the message I would give.
Thank you. And that's all that we have time for tonight. We thank you all so much, our panelists, for your time and your thoughts on the booster vaccine. We now have a quick message from our sponsor.
Since the beginning of the pandemic, Doctors of Waikiki has been on the front line caring for locals and visitors. We have always believed that working together as one Ohana, we can beat this. Although Omicron seems less severe, this isn't the time to let our guards down. The best protection for yourself and your family is 2 shots of the vaccine plus the booster. We see positive COVID patients every day who have both shots and the booster and have minor symptoms. We also see unvaccinated patients who need to be sent to the hospital. There are many breakthrough infections, and the possibility of new mutation will continue to occur beyond Delta and Omicron. We encourage everyone who hasn't gotten their booster to get it as soon as possible. Mahalo and stay safe.
And we thank you at home so much for watching tonight. For more on the COVID vaccine and the boosters, visit our website, khon2.com. Mahalo and good night.